My name is Anahita Dua. I'm a vascular surgeon at Massachusetts General Hospital and an associate professor of surgery at Harvard Medical School, and also a Southern New Hampshire health provider, specifically in vascular surgery here in Nashua. So PAD stands for Peripheral Artery Disease, and that's just a mouthful to say that it's disease of the blood vessels that are in your arms and legs, specifically your legs. Plaque that builds up in the blood vessels in the leg prevents blood from getting down to your toes. So when you walk, or sometimes if you're trying to go up your driveway, if it's on an incline, you start to get pain in your legs. This can progress ultimately to even having not enough blood flow getting to the toes and gangrene setting in, which is just dead tissue. The people that are most at risk for PAD are those that are smokers, that have high blood pressure, and that have previously had any type of vascular disease in the past, for example, a stroke or a heart attack. And depending on the type of PAD you have, whether it is the kind where it primarily hurts when you walk or the kind where you actually have tissue damage, we do different things for you to ensure that you get that blood flow and we can save those legs. The signs and symptoms to watch for with PAD, number one is pain, of course, in your legs. Number two is pain that's persisting even though you're not doing anything. For example, if you were just lying in bed but your foot is just throbbing, hurting, that's something called rest pain. And that falls into a category of PAD called critical limb ischemia, which stands for critical, it's critical, limb is your leg, and ischemia is not having enough blood flow. Other signs and symptoms of PAD, specifically critical limb ischemia, can be a wound that you have on the foot that's not healing. Now, this wound could have formed because you stepped on a nail or your grandchild accidentally rolled over your foot, or it can just form spontaneously. But whatever the cause may be, the wound should heal after a particular set of time. And if it's not, or if it's taking way too long, that may be a sign that you don't have enough blood flow and you have critical limb ischemia under the umbrella of PAD. If you're experiencing these signs and symptoms, it is imperative that you come and see a vascular surgeon as soon as possible. And the reason for that is time is tissue, is something that we like to say. And what that means is the longer you wait on something, the more some of that tissue on your foot, some of that skin and some of that actual fat and muscle will die off. And no matter what I do for you to get blood flow down there, what is dead will remain dead. So our job is to stop things in its tracks and ensure that that gangrene doesn't spread up your leg. So worst case scenario, let's say that you have pain in your leg and you don't know what it is and you come to see me and it turns out it's not a blood flow issue, which is actually kind of also the best case scenario. And maybe it's something else, like an orthopedic injury, maybe you have a tendon or a bone that's causing you trouble, maybe you have a bunion that's causing you trouble. I would be able to identify that for you and get you to the right provider quickly so that you don't have to live with that pain. But if indeed you do have a vascular issue, I can move quickly, get you that blood flow so that we can ensure that your leg is not threatened and your life is not threatened.